Hi, my name is Mike Ruppel. I'm a physical therapist at Freedom Physical Therapy in Grafton, and we're here this morning doing a basic pitching assessment. I'd like to introduce Brad and Tom. Tom is the head coach here at Cedar Grove. Brad is a pitcher. He's going to be our demonstrator today. He's going to be our athlete. So what you didn't see on camera is he's already dynamically warmed up and ready to go. Me personally, when I do a pitching assessment, there's some basic equipment that I like to bring along, and all you really need is your cell phone. So if you're going to do a pitching assessment, what you need to do is you need to have a stopwatch, either on your cell phone or around your neck or on your watch, and you need to have video capability on your camera, which every camera does. There are some apps out there that can slow the motion down so that you can look at it frame to frame, and I would recommend that. There's nothing that you can pick up in a pitching assessment on video or with your eye. You can't pick it up. It's just things happen way too fast, and you think you're seeing something that may or may not be there, which could be detrimental to the athlete. So video capability, you want to take multi-angle, you have to have a stopwatch. Those are probably the biggest pieces to start with when you come out and you do a pitching assessment. Before I even put an athlete on the mound, what I like to do is I like to have some basic marks. The mound should be pretty much manicured so that you can see some key indicators with their feet. So you should be able to see their front foot step. You should be able to see their back leg drag line. Dirt mound is the best if you're outside. You should be able to pick these things up. So if it's perfectly clean, it makes it much easier. So bring a broom, bring a rake, make sure you can see those identifying marks. If you're inside on an artificial mound, I always throw a tape mark down the center of the mound so that I can videotape and I can see where their back foot drag line is. And that's really important when we start talking about proper setup when the pitcher's throwing. So I'll find the center of the mound and I'll just take my foot, kind of go straight down the middle so you get an idea, and it should go straight down to the center of home plate. Okay, and what that does is it gives me a mark as to where that back foot drag line will be. Brad, if you want to go ahead and step up on the mound. So some guys will dig out, some guys won't. I never really do an assessment with the pitcher working out of the windup to start. I always have him work out of the stretch, so I'm going to have him work out of the stretch. The first thing I always take a look at is, and what I'll ask them is this your stance to start? Okay, so they're going to get into their stretch. I'm going to have them come set, and I want to see where they are posture-wise in their set position. So go ahead and come back into your set position. So Brad's been through this before. He kind of knows where I want him to be. When he comes back, you want to be in a strong athletic position. Okay, you want your foundation to be sound, and his foundation is sound. His feet are about shoulder width apart underneath his armpit. His knees are bent. Still should be relaxed up here, okay? If I push on him, he's gonna be strong. Just go ahead and straighten out your legs once. Lock your legs out straight, be strong. See the sway? See how I can push him real easy? Now go back into a solid fit. Much firmer, much solid foundation. That's the key. Proper setup. Make sure your legs aren't locked out. Make sure you're in an athletic stance. Especially with the younger players, if they've grown a lot, automatically drop them down because their mind, body isn't connected. They're not functionally strong enough to throw from that new position that they're in, the height that they've grown. Usually if you drop them down 2 to 3 inches, they're in the zone. So it'll make a more consistent down. So go ahead and get into your stance again. Strong athletic stance, he's in a good position. Okay, the next thing I'm gonna take a look at, and I'd probably videotape this if I had videotape, and I'm gonna videotape open side, okay? Open side, I'm gonna come and I'm gonna videotape from the front side. And I will videotape from the back side also. Sorry, radio should have started that way. All right. The one videotape that I can never get, especially when I'm doing it on my own, is from on top. And that's very important when we start talking about rotation, hip-shoulder separation. You can see it from the side, from the open side. You can see it from the back side a little bit. You can see it from the front side. But real important to see it from on top to see if you can get that degree angle of hip-shoulder separation. We can't do it here. Some of the fancier academies have it. We just don't. But you don't absolutely have to have it, especially if you're outdoor. So most of the time, when I'm doing this, I'll come back to the open side and I'll take a look at him. Typically when I'm working, I'll just stand behind the pitcher. If we've got a catcher there, I'll have him throw multiple pitches to the catcher. I usually stand here with my watch or a stopwatch and I will time him front foot up to front foot down. Front foot up to front foot down should be 0.95 to 1.05 seconds. If he's within that time range, we know that that's the MLB average. We know mechanically he's going to be sound. It's going to take stress off his shoulder and his elbow. It should help reduce injury. So I'll typically stand here with a stopwatch. I've got my watch here in my hand, and Brad, just go ahead and throw down to Tom, okay? What I'm going to do is I'm going to time him multiple times. So, and if I'm working with him consistently, I'm going to time him with every pitch to make sure that that consistency, like he was right at 1 second there. I want every pitch to be at 1 second. You never want that timing to be something different. Okay. So after I do the timing a couple of times, we've already got markers here. Okay, so when we come up over the top, I'm going to have you step back, Brad, and Brady, if you can bring it here. So if you come over the top, you can see where his front foot is landing. You can kind of see a little bit of where his drag line is right here. And what I'm going to look for is I'm going to look for the length of his step going down the mound, which should be 6 to 7. If it's 6 to 7 of his feet, and it doesn't matter the age of the player, it's just 6 to 7 of their feet. And then you want to see the drag line here. When he's done with his drag line, it should be on the center going down towards the middle of the plate. Okay? I can tell after doing this for a number of years the length of the drag line if he's a short stepper or a long stepper. So you want to look at the length going down front foot. You also want to look at the length going down with his back foot drag. His back foot drag should be 1 to 2 feet. Okay, then you know that he's probably going to be a 6 to 7 stepper. Brad, if I can have you, I'm going to have you put your foot here. And I want you to walk down the mound heel toe to that other mark, and let's just see where you're at. 1, 2, 3, 5, 6. So he's right at 6. Okay. So that's acceptable. If I was working with them consistently, I would say we want to work towards 7. The further down you get, the further you get down the mound, for every foot you go down, it's 3 miles perceived velocity on your fastball. Okay, and that's just a physics problem. There's less time for the hitter to see the ball. It gets on him a little bit quicker. So that's why that's so important. Plus, with the timing and the step length, it really reduces the stress on the shoulder and the elbow. So those are really the 3 big things that I look at when I start my pitching assessment. Are they setting up properly? Is their timing within that 0.95 to 1.05 seconds? And is their step length between 6 to 7 of their feet going down, their drag line in the middle going towards home plate, and it should be at least 1 foot to 2 of their feet, 1 to 2 feet of drag line coming down. If it's there, you don't even have to measure. You don't need a tape measure. You can just see it automatically. So I would say right now, he just finished his sophomore year. Looking at those things, he's pretty sound. He's pretty sound. Now, the other thing is as we look at the video, other key things that we see with especially young players, and I would consider Brad a young player, is where is his back knee angle going? What's his hip shoulder separation angle? Is he strong on his glove side? Okay. Those are really big things. Those are big mechanical things that we see with a lot of young players. Also, are his hips and his shoulders level as he's coming down the mound? That's the other big thing that I see. And usually you see a weak glove side and you'll see a bad hip pelvis angle. And those things will really make you less consistent, and they put a lot of stress on your shoulder and your elbow, which will cause damage. You'll have arm soreness. It'll make you less effective as a pitcher. And you usually have to do some arm care stuff afterwards. We'll probably see them in the clinic if those things aren't where they need to be. But that's where I start with every pitcher, are those 3 basic things, and then we break down the video and we look at smaller things. 80 to 90% of all mechanical flaws will fall out on every pitcher if you get them setting up proper, you get their timing right, and you get their step length right, and you get it going in the right direction with their drag.